Next, Hashir is going to give us the gift of his story.
Hello, everyone. My name is Hashir. I'm an undergrad student at Western studying biological sciences. The plan's to be a doctor, but we'll see how that goes. I'm also a part of the Child and Youth Advisory Council at the Children's Hospital since 2011. And just saying, it's been an amazing experience so far, being able to give back to the hospital who has helped me so much through my journey so far. What we do is that we're basically a group of patients and siblings who give ideas to the hospital about how to better engage patients and provide care that is meaningful, as well as try to make the stay of patients at the hospital as amazing as possible. And we also implement ideas or try to improve already set standards. And like I've said, it's been fun and insanely amazing so far. So I'm a type 1 diabetic. It all happened once upon a time in May 2007. It was me, my dad, and a couple of friends. We went to a park and we played soccer. Now, one of my friends, the competitive person I am, I tackled him, and he got the notion to tackle me back, but he did that and I stopped breathing. Great. So thankfully, I'm breathing now. It's good. But my parents wanted to make sure everything was fine, so they took me to my family doctor. I was 12 years old, so my doctor asked me, okay, what's going on? And I'm like, I have no idea. All that I remember is that yesterday I fell and I stopped breathing. And the doctor didn't ask me anything else. He asked my parents, what's going on? And my parents are like, oh, he's waking up in the night to use the washroom frequently. He's drinking a lot of water. He's tired. He's lost weight. He's done this and all that. And my doctor automatically recognized that it might be diabetes. So he checked my blood sugar. I had no idea what that was at the time. He sent us home. I felt fine. But the next day I got home from school, my mom's waiting in the door and dad's waiting outside. They're like, drop your bag, we're going to the emergency room. What? Why? Oh, because they didn't tell me, and I'll explain why they didn't tell me later. I'll just keep it at the fact that they didn't tell me for now. But I dropped my bag, we went to the emergency room. It was the diabetes center in the adult hospital in Scarborough, Ontario. And we went there, they did a bunch of tests. I still had no idea what was going on, which really does still bother me because I saw so many nurses and doctors and not one of them told me, you might have diabetes. And it's not like I didn't understand what diabetes was. I did because I had a friend we were on the track team and he was diabetic. But just no one took the time to explain to a 12-year-old, I guess, what diabetes was. Anyways, so it was around 12:30 a.m. They gave me an injection. This was probably my face while the injection was going on, but it turned out that the needles was like this small, but okay then, awkward. But anyways, we went home, and the next morning we went to Sick Kids Hospital in Toronto, which is an amazing hospital. Everything made sense there because they use words and terminology that was understandable for a 12-year-old instead of using words like hypoglycemia, hyperglycemia, hemoglobin. I bet half of you didn't understand what those words meant. But yeah, they use words that were understandable, like low blood sugar, and they explained everything very well. And also it was more application-based, They, instead of teaching me something, they gave me a teddy bear, and they're like, okay, this is how you check your blood sugar, or this is how you give insulin, which was appreciated because, for me, I'm more of an application-based learner or visual learner, and instead of telling me stuff, I'd rather you teach me by using my hands or, a board. Anyways, when they told us that I had diabetes, my parents were devastated. My mom started crying, and Dad had tears in his eyes. Wait, what? Dad has tears in his eyes? That's a first. I've never seen that before. It must be serious. But this part always gets me choked up just because I had a nurse named Melissa Dupuy. I still look up to her in ways. She walked into the room and she's like, you have diabetes. And my mom started crying, like I said. But what happened was that she had tears in her eyes. She came up to me, gave me a hug, and she told me everything was going to be all right. My dad asked her, she's like, why do you say that? He has diabetes. His life is over. Okay? But what happened was that she told me I was his age when I had diabetes. And legit, this was my face when she told me that. She's like, I was 12 years old when I was diagnosed with diabetes. We didn't believe her at first, but then she showed us her medical alert bracelet. And I'm like, oh, wow, okay, whoa, she has diabetes? No way. Okay, wait. She's tall, she's beautiful, she's smart, she has a future, and she looks normal. Wow, okay, that means I'm gonna be normal too. Okay, that's good. So honestly, that little interaction right there between the nurse and me made the whole world to me. I swear from there on out, I didn't see diabetes as a problem or a disease for me. I saw it as a challenge to rise up to. And I'm saying this because as a diabetic, it'd be hard to explain what I go through on a daily basis, but I'll put it into two categories. The first category is the health category, which is checking your blood sugars and maintaining your readings. And when you're sick, just making sure you don't have ketones and all that. That's not a problem. Like Melissa said to me, it's like brushing your teeth. Sooner or later it becomes like that, which is true. It does. It has. The other part is the social category, which is you tell someone you're diabetic and they're like, oh, that's not good. Like, hey, are you judging me because I'm diabetic? Or saying something like, are you sure you should be doing that? I've had diabetes for 7 years. I think I know what I'm doing. Like an example would be, I went to get contacts, and one of the employees there was trying to avoid me getting contacts because I was diabetic. Even though, my doctor said, yeah, it's cool, go for it, get contacts as long as you take proper care of them. But anyways, yeah, that's one story. And then another story is me at the gym. I'm a gym freak, as some people put it. So I was lifting weights, and this guy, he's like, wow, you're doing well. And I'm like, yeah, thanks. And then he saw my insulin pump. He's like, wait, what? Are you on a heart rate monitor? And I'm like, no, it's an insulin. But he's like, oh, you're diabetic? Are you sure you should be lifting that much? I'm like, what does that have to do with my diabetes? But anyways, yeah. That's the social category, which I have to deal with on a daily basis. But to be honest, it used to bother me that people thought of me that way, but now it's just become a challenge to rise to prove people wrong. And thanks to my healthcare team here and my family and everyone around me, it's happened. I've proved people wrong, and I still am. Now, see, my parents didn't want to tell me that I had diabetes because my uncle back home had diabetes. Unfortunately, he passed away at the age of 28. Back home for me is Pakistan. We lived in a village, so the medical facilities there weren't the best. And unfortunately, he developed vision problems, kidney problems, liver problems. His height was stunted. He just couldn't function to the point where, unfortunately, he passed away. I tried helping him in March 2009. I took diabetes supplies with me when we went for a visit. I taught him everything, and it's surprising to know that I knew more than half the doctors there. So I tried, but unfortunately in 2010, June 2010, there was a major flood. Everything got wiped out, and he developed conditions, and no one could help him. He passed away. So that's just one positive aspect, the fact that Melissa was able to share that story and give me support, especially knowing that my background, we thought of diabetes as like a disablement, like you sit at home, you can't do anything. But the fact that she shared that one small gesture of hers, to her it seems like a small gesture, but to us it means the world. And as a patient, just interacting with us in that way shows that you care for us. And another positive aspect that I'd like to mention is that Well, 2 years after I was diagnosed, 2007 I was diagnosed. So 2009 I moved to London, but at that time I was learning how to use this guy, my insulin pump. This thing right here. Anyways, yeah, so unfortunately we had to commute once a week to Toronto, and that was a 2-hour ride, and I really hated it. But as soon as the team here figured out that I had to commute to Toronto once a week, they're like, well, what? That's not cool. Like, you need to, why not we take over your pump training here? And they did it in such a fashion that I didn't even notice that I switched hospitals. I'm not gonna lie, I hated the team here at first because my team back there was amazing. But turns out they here were amazing, and they did an amazing job. Like, everything was based on me again, if the timing worked for me, they were cool with it. If it didn't work for me, that they scheduled it like it was nothing. Everything was based on me, and that, means a lot. Anyways, so, that really did help a lot. And at first I did hate the pump. I remember throwing it out my bedroom window. My dad's downstairs barbecuing, and he goes, wait, what? Is that Hashir's insulin pump? What's that doing down here? I hated it at first because I didn't hate it because it's an amazing device. I just hated the fact that I had to commute to Toronto once a week to learn how to do it, especially because it was summer and I wanted to enjoy my summer. Anyways, but honestly, like I said, the team here has been amazing so far. Unfortunately, I'm getting fired because I'm 18, so I have to move to the adult section. So, negative. Like I said, the healthcare team here and in Toronto were amazing, but there's just these 2 events that really stand out to me that I wish could have gone better. The first one was a 3-month checkup for my HbA1c, which is a test they do. They do the blood work, and then they make sure that your average blood sugars for that 3 months was under control. 5 is normal, so person without diabetes is a 5. 6 is amazing for a diabetic. 7 is good. 8 is like you really need to get your stuff together. So mine's turned out to be 8.1. Not good. The doctor walked in. Oh, hey, how's it going? Okay, good. Nurse walks in. Okay, nurse walks in. Dietitian, oh, okay, all of them in the same room at once. What's going on? Social worker, okay. Right? And then they're all just staring at me like, what's going on? Like, someone tell me what's going on. And then they're like, is everything all right? I'm like, yeah, everything's fine. They're like, could we see your readings? Yeah, sure. So I show them my readings. They're like, can we see your meter? You want to see my meter? That's a first? Okay, sure. They're like, are these readings accurate? Like they're basically blaming me for the situation, like if I'm making up results or not, which didn't suit well with me at all. But then, they start talking to my father, and they're like, okay, we're going to put him on a 24-hour blood sugar monitoring device to see where, his blood sugars are spiking so we can fix the problem. And they didn't really consider me as a patient in that situation. Instead, they were going to my father. And it got to the point where they were about to order it, and I told my dad, I'm like, Dad, I want to do the test again. And I said that in my language. And my dad agreed. So we did the test again. Turns out it was 7.1. Oh, yay, okay, everything's fine. The point is that in that story, from this story, it just felt like they didn't treat me the way they used to just because my HbA1c was 8.1 instead of the regular number it should have been. Instead, they jumped to conclusions and they panicked, which honestly made me feel like everything that happened, when did this happen? 2010? So everything that happened within that year or two, the bonds I made with them, it just felt like all of those were shattered right there and then because they didn't trust me just because of that one mishap that happened because of machine. And the second negative aspect was with a resident that was under my endocrinologist's guidance. Just because you've been to medical school does not mean you know everything. Just saying. There's still a lot to learn. But anyways, the resident walked into our room, and he started talking. He's like, "Hey, how are you?" I'm like, "Oh, I'm good. How are you?" "Good, good, good." "Okay." And then he just totally ignored me. Like, let's say my dad's sitting on this side, and I'm the resident, and I'm sitting on this side. So, "Hey, how are you?" "Okay, good, good." "Okay, so how have his blood sugar readings been?" And my dad's like, "Wait, what? I have nothing to do with his readings. Like, he's the one that does everything. I'm an independent guy. I do everything myself. But if I need the help, I'll ask." So my dad's like, "I'm sorry, what was that?" "They've been good." And then he's like waiting for me to interfere. And I'm like, "Yeah, they've been good. Like, you want to see them? Here you go." He goes, "Oh, okay, okay." And then instead of like telling me, "Oh, they've been good," or "You should do this," or "You should do that," he goes, "So how are his carbs, and how much insulin is he taking, and all that?" So my dad's like, right? And I'm a sassy guy. I've been told that a lot. So I'm like, "Okay, you're gonna play that game? Fine." I took out my iPod. I started playing games, acting like a kid, right? Until finally my endocrinologist walked in, and I'm like, "Oh, thank God." Okay, so he walks in and he starts talking to me and everything, and we have that. Usually, it's become like a thing for us that we have a convo about our lives and how he's doing in his school, like my school, not his school. He's done school. I wish I was done, but not yet. Anyways, yeah. So we have that convo, and then all he says to my dad is, "Hey, how's it going?" "Yeah, okay." He treats me as the main priority, which really does matter to us as patients, at least to me. And then he's like, "So can I see your blood sugar readings?" "Yeah, sure." I give him my blood sugar readings. And then he's like, "Can I see your pump?" "Yeah, sure, go for it." I show him my pump, and the resident's just sitting there. He's like, "Wait, he's 15 years old. Like, the dad's right there. He's underage. What are you doing?" Right? So the point is that, we try to interact with the patient instead of going, if the patient, even if he's like 10 years old, doesn't matter. I feel like if you were to interact with me, or try to at least, it would mean the world to me compared to going to my parents first. And the fact that just inside that little bubble that's your healthcare team, they treat you as the main priority, but outside of that bubble, it just seems that everyone else, if you're underage, doesn't treat you as the patient. They go to your parents or your guardian, right? Which I feel like, it's upsetting, because you think, okay, I'm the one that's been through the most as the patient, yet you're going to my parents for advice, or yet you're going to whoever else you need to for advice. So that's the second one, and to be honest, that was the last one too. Like I've said, the healthcare team here has been amazing. Just two small notes. I won't say they're negative aspects, but communicate within each other. Don't think you can do it all alone, because you can't, no matter what it is. Just an example is, the family doctor is supposed to get all the results, right, after a checkup or after something like that. And I figured out in late February that I have optic atrophy. Ooh, okay, what is that? Degradation of the optic nerve, so I could potentially go blind. Okay, I got over it, but my parents are still not over it. They're trying to encourage me, and my siblings are at home, and they're acting nicer than usual to me. I like it, not gonna lie, but, anyways, yeah, so, like, my family doctor should be able to access results without me going there, and he goes, "Oh, wait, what? I didn't know about that." Like, please send results with each other so things go faster for me as a patient, because it's frustrating to know that you have to go in one time and he's like, "Oh, I don't have that here. When did this happen?" And then you have to sign a form and then send the results to him. and then you have to go back again. Like, that wastes a lot of time. And as a patient, it bothers us because we're already worried about ourselves, our health, and the time it takes. Like, a day can feel so long. That was me, like, well, it still is. And the other thing is that take the time to understand the patient as an individual and as a person, because instead of, see, an example would be my family doctor. He's like, okay, your appointment's at 2:30. Okay. I had an exam the next day, but my dad dragged me to the doctor's. And I told him, I'm like, okay, sure. So we go at 2:30. I sit there for 25 minutes, and he's like, okay, come in. Okay, we go in. Doctor shows up, but doctor's like, oh, sorry, I only have 5 minutes because I have to leave at 3. Seriously? Are you serious right now? Like, I have an exam tomorrow, and I've squashed that night, and then I have a squash tournament on Sunday, and you're telling me you have 5 minutes for me? Come on. So honestly, that moment right there, I was ticked. I really was. I was angered, and it really did sadden me to know that, they don't care. Like, it felt like he didn't care about me at all. He was just in it for whatever he was in it for, probably the money. But no, but honestly, take the time with patience to deal with them, and make sure that you deal with it as to the best of your abilities as possible, and try relating to them at least in any way you can. Although that day did go better because I went on a shopping spree and bought a laptop and whatnot. But yeah, all in all, I'd like to say that the best care for me happened when the provider was considering my feelings and my unique situation, and based on that, they made judgments before making judgments instead of understanding me first. And try relating to what I'm going through based on the health category and the social category, like what I have to go through in both, not just the health categories. It's not like I step into the hospital and, okay, we're gonna deal with him from now. Like deal with us with what else we have outside of the hospital as well, right? And this honestly makes a huge difference in my life, and I chose to become a doctor after that interaction I had with Melissa, and who knows who you could inspire to do something. And I would also like to thank the king. Where is he? Oh, there he is. And also Lisa for giving me the opportunity to share my story. Thank you very much.